Hello and welcome to the Majlis, Radio for Your Freedom Liberties Current Affairs podcast focusing on Central Asia. I am Mohammed Tahir, the host of the Majlis podcast and Radio for Your Freedom Liberties media manager for South and Central Asia here in Washington, D.C. As we speak, Chinese officials have confirmed nearly 8,000 cases of the coronavirus and the death toll hitting 170 people in counting. As an outbreak expands as far as the United States, neighboring countries in Central Asia are in little panic. In Kazakhstan, over the past days, a number of people were hospitalized. A number of them were discharged with the suspected coronavirus cases, and authorities are calling for testing of anyone who came from China after January 6. The land and air links between two countries are restricted, and Kyrgyzstan's border with China remains closed until February 1st. And discussions are underway to find an alternative market for food imports away from China. So today on the Majlis podcast, we are here to discuss and also do a quick reality check to understand how Central Asia is trying to cope with this situation and how effective their measures are. To discuss all these, I'm joined by Dr. Bruce Pannier, Assistant Professor at the New York University School of Medicine, who specializes in infectious disease; Dana Sansieva, Senior Journalist with the Radio for Europe, Radio Liberties Kazakhstan Service; Aynura Asankujaeva, Senior Journalist from our Kyrgyzstan Service; and Bruce Pannier is joining us, who is the editor of Radio for Europe, Radio Liberties Central Asia blog, Kishlok Owazi. Thank you, colleagues, for joining us today. So our hope is today to find out what is happening in Central Asia with regards to coronavirus. But first, we will try to make sense of what is that we are really talking about. For that, I'm so happy that Dr. Pannier could join us today. Then we will expand the debate, talking about what the authorities in Central Asia are doing about it. And also, I would love everyone to join me in trying to read Dr. Pannier's brain on this. So please don't hesitate to jump in and ask your questions. So Dr. Pannier, as we speak, the coronavirus cases are seen in more than 20 countries. China has isolated millions of people, and now Australia is planning to isolate nearly 600 of its citizens in an island following their evacuation from China. And of course, more and more countries are reporting the cases of coronavirus, including the United States and Canada. And yesterday, India reported the first such case. And yet, countries in Central Asia, which has a huge border with China and significant travel and trade ties with it, yet to confirm any such case. So this brings me to my first question. How is this virus transmitted? I heard experts talking about human-to-human contact is causing this, or human-to-animal contact is causing this. So what's your understanding?
Right. So I think the initial way that it did infect humans was from animals. They believe it was isolated from a seafood and animal market in China, in the Wuhan region. But the thing that's concerning is now that we've confirmed that it is able to spread from human to human, and it's through respiratory droplets. So it's almost similar to the flu, So that's why it's so concerning. And that's why when cases are popping up, we're trying to isolate them or quarantine them, because although we don't have human-to-human contact in the U.S. and some other countries across Asia, we're seeing it quite rapidly. And some countries have even closed their borders, such as Hong Kong, because of this reason.
When you say human-to-human contact, is there anything that an individual can do to prevent it? Any practical kind of measures that we could take?
So it's similar to, let's say, if you have the cold or the flu. The coronavirus actually is the same virus as the common cold, but this is actually a mutated version of it. And as you know, the common cold, many of us get it. It's quite mild, but so it's spread the same way. So it's through touch, through, what we call respiratory droplets. So what we always say is, wash your hands frequently. Yes, avoid handshaking, avoid interacting with people if you know they're sick or they have upper respiratory symptoms. And a lot of the symptoms are very similar to any other virus we may experience, like runny nose, cough, fever, fatigue, things like that. So, but yeah, frequent hand washing and avoiding contact with sick people is the best prevention so far. There's no vaccine.
This question might not be very much related to medical, but let me ask this. So the fact that it's quickly spreading around the world, like United States, Canada, countries far away from China. So what do you attribute this to?
Well, I think it's because in this day and age, an outbreak anywhere is an outbreak everywhere. People are traveling very frequently compared to maybe 50 years ago, 60 years ago. So any outbreak in China can easily go anywhere, right? Because people are taking international flights, people are interacting with so many people, especially in this time of year, there's a lot of air travel and transport.
So keeping what you said just in mind, let me ask a little political question to you. If we were to believe Central Asian authorities, which not only shares long border with China, also maintains significant travel and trade ties, they yet to confirm an existence of such case in their countries. What they must be doing right that the other countries are apparently not able to find yet?
Yeah, so that's actually a good question. I don't know if those countries have already limited travel between the two countries. They might be more vigilant in maybe screening people as they come in through the airports, and if there is any suspicious cases, isolating them quickly. Because if you are able to identify someone with the virus and get them isolated, then it's much less likely it will spread. So in the U.S., we have 5 cases now for almost a week, but luckily so far we haven't heard much spread because they were identified quickly and they've been kept in isolation. So because that's the main way to prevent the spread is avoiding contact with those sick individuals.
Let me also bring my colleagues who are on this show. So the type of measures Dr. Pannier was talking about, have you seen any such measures being taken in your respective countries? Who wants to start? Dana, maybe?
Yeah, I will start. Ainura from Kyrgyz service. Now, I would say to the panic, it's a little bit strong word, the panic, which the word you mentioned at the beginning in our case, in case of Kyrgyzstan, it's a little bit strong word, I think.
Right.
And according to our health ministry, the epidemic situation is normal. And there are no cases of coronavirus.
So that's kind of raising a question. They say they have no cases. When you have these cases in the United States and Canada, faraway countries, how come Central Asia is safe? What they must be doing that it's safe? While
our border with China is closed since 23rd of January. No flights from China. We have only one direct flight from China, Urumqi-Bishkek, and that flight was stopped several days ago. So, but this is a usual measure because in this, due to the Lunar New Year, China always, they shutting down the border with Kyrgyzstan.
So the China shut down the border, not Kyrgyzstan. Is it the way I should understand that?
Yes, but this measure was before the virus. Before this outbreak.
Okay.
So every year we are witnessing this measure. This period of time.
Okay. So
we have 12 students who came back from China via Kazakhstan, and they are now isolated. They will be in isolation for, 10 days, what we were told.
So coming back to the measures that Dr. Pannier was talking about, Dana, I see Kazakhstan is hyperactive. One reason why I was saying that there is little panic in Central Asia is what the authorities in Kazakhstan is doing or saying or not saying. So the measures that Dr. Pannier has mentioned, have you seen anything like that being taken in Kazakhstan?
Today there are. We can say that officially 38 people are suspicious of having coronavirus, and they are kept in kind of special occasions. And still, they are making some analysis about what actually they might have, because initially there were 54 people, and 16 of them didn't have any kind of this infection.
Okay, so what about the borders, Dana? The air, rail, and land links, are they closed?
So far in Kazakhstan, the border with China is not closed. Only cross-border bus journeys are not allowed since January 29th. Trains movement will be closing on February 1st, and airlines will close at February 3rd. So there are still airlines and still trains. And one of the official reasons is that there are 1,300 Kazakhstani citizens in China, and they are hoping that these people might have the opportunity to come back to their country.
And there are a number of students in Wuhan, as I understand, 23?
98 students,
90.
yeah.
Okay.
And officials of Kazakhstan wrote to the Beijing that they want these students to come back and have the opportunity for them to also come back to their country.
So we will have opportunity to talk about type of activities taking place in our Central Asian countries a little bit later. But now that we have Dr. Parikh, I wanted to have all of our questions asked in terms of the medical aspect of this. But before that, is there anything to add? The type of activities taking place in Tajikistan on this? I mean, Tajikistan also has a border with China.
I do know that the Tajik government estimates there's at least 6,000 Chinese workers in Tajikistan right now. And so they're kind of doing a very fast census and not only to find out how many of them there are, but who might have left to go back home for the Lunar New Year. So they're trying to figure out how many of the Chinese citizens stayed in the country and how many left and are expected to come back, so that they can certainly do checkups on the ones that do come back that have left for China. But so far, that's all they've closed their roads and they stopped the flights to China also, but there weren't that many.
Mm-hmm. So coming back to Dr. Parikh, as far as I understand from your comments earlier on one of the national TVs, I guess CNBC, so we don't have yet cure for this virus, do we?
Correct. There is no cure. There's also no vaccine, which they're, I think, rapidly trying to develop one as it spreads. But that could actually take weeks to months to happen, So right now, prevention is the smartest thing and the only thing.
And prevention being?
Prevention being avoiding sick contacts, avoiding those areas where there are many cases, frequent hand washing, not touching other people as much as possible, as you mentioned, like with handshakes and things like that, because we have confirmed the human-to-human spread. But on the same note, with the word panic, there is really no need to panic outside of those areas where we've confirmed high cases. I know a lot of people are very nervous. For example, I live in New York, and in the U.S., people are already wearing those face masks and things here. But what they're not understanding is that here, actually, the flu is much more dangerous and deadly, and we actually have a vaccine for that. So people need to kind of protect themselves against that. So it is something to worry about, but also there's no need to panic if you are far removed from those regions as of yet. Yeah.
So in terms of these concerns, Bruce?
If I can ask something, how effective are those masks against this virus?
Yeah. That's a very good question. They're not extremely effective because it depends on the type of mask. So the paper masks that you see everybody wear, or the surgical masks, they're a little bit of a barrier, but still small particles can get inside the mask. Now, there's other masks that we call respirator masks that have like a little bit of a tighter seal that we use in the hospital and things like that. So that's a little better, right? But nothing is 100% foolproof, The best thing, again, is just avoiding sick people and washing your hands as much as possible. Every little bit helps, but again, it's no guarantee.
Yeah. On that, so once it is determined that someone caught this virus, how quickly this thing develops from there?
So that's another problem with this virus versus others. It can take up to 2 weeks to develop symptoms. So if you've been in that area, it's not that you're safe after 5 days or 7 days like with other viruses. This, you really have to be careful and watch yourself for up to 2 weeks. And a lot of people here, even in the U.S., when they flew in from China, they're self-quarantining themselves, especially a lot of our citizens in Chinatown and things like that are purposely staying home for the next up to even 14 days.
Now, there are exactly, we don't know how many students from Central Asian countries are in Wuhan, which is at the epicenter of this virus. And now it looks like it is closed down by the Chinese authorities. So what's the best thing that the authorities can do to help them in this stage?
So the students that are currently in China, you're saying? Or?
Yeah, in China and especially in Wuhan.
Right. So, those students, the best thing that they can do is almost, isolate themselves, try not to go into crowded areas, wash their hands frequently. They absolutely should not travel or leave, because if they have been exposed, then they risk infecting others, But, as long as the good news is, even though there's been many cases, the death toll is still under, I believe, 3% or 2% right now. So, hopefully those students are relatively healthy, and even if they catch it, it would be more like, cold or flu symptoms for them and not something more dangerous. But again, same precautions. Yeah. They have to protect themselves, avoid crowded areas.
Yeah, is there anything that the authorities back in their home countries, like Central Asian authorities, can do about them? Anything you could think of?
Nothing right now, only because, we don't have enough information, or we don't even have any vaccine or anything like that, because the problem is, you can't even say, like with other disasters, countries help bring their citizens back, but in this case, it's not a good idea, because then if they have been exposed and they're coming from that region, they can spread the virus, But if they come back, then their country has to make sure those students, basically stay isolated for 2 weeks and make sure they don't develop symptoms, So it's a tricky situation, because you don't want these people traveling around either.
Right. I guess there are a lot needs to be unpacked here. I see we are more than halfway through the discussion, so let's expand this to what's happening on the ground in Central Asia with regards to this virus. How are they coping with that? First, let me recap the debate that today on the Majlis podcast. I'm joined by Dr. Bruce Pannier, the New York University School of Medicine professor, an expert in infectious disease, Dana Santsiba, senior journalist with Radio Free Europe, Radio Liberty's Kazakhstan service, Aynura Asan-Kujayeva, senior journalist with our Kyrgyzstan service, Bruce Pannier, editor of our Central Asia blog, Kishlok Awazi. I'm Mohammed Tahir, Radio Free Europe, Radio Liberty's media manager for Southern Central Asia here in Washington, D.C., and we are discussing the risk of coronavirus in Central Asia and how the region is trying to cope with it. So, Dr. Pannier, if you have time, we would love to have you to stay. But if you have to leave, I think we will survive. So you already gave us so much of your time today. Thank you very much for that.
Yeah, thank you so much. I would love to stay, but unfortunately I do have to get back to work. But thank you.
Understand.
Thank you for having me.
Thank you. So Dr. Pannier is gone. So let's start from Kazakhstan. The latest news is, I think, Dana, you said, the number of cases. I didn't know that there are so many suspected cases in Kazakhstan. I heard about the 6 people who were hospitalized earlier, and some of them were discharged later. So what's the fresh statement? Is there anything came out today from the authorities?
Yes. Okay. The dates are changing. The numbers are changing every day. So the official kind of statement is that today they have 38 people with suspicion on having coronavirus in the hospitals in special conditions.
So about the air and land links, I heard this from your, I think, TV show today, I guess. So the rail link will be closed by February something, and the air link, and what are the restricted measures they are taking?
Yeah, train movements will close on February 1st, and airline and flights will close on February 3rd.
And some visa arrangements were also restricted, right?
Yeah, since February 29, they stopped to give any visa to Chinese citizens, and it's kind of for a limited time. I'm not sure what is the end of that kind of rule.
Mm-hmm. Bruce, about the Tajikistan, what this country is doing, so what the authorities are talking about. There was a rumor the other day that a passenger died on his way from China to Dushanbe on the airplane, apparently due to this virus, which was denied by the airlines, I guess. And now they have stepped up their restrictions on their border with Central Asia and China. What else has been happening?
I suppose Tajikistan might be the most fortunate of all of the 3 countries that border China and Central Asia, because the land links that they had, and in fact, most of the plane, the airplane and train, they don't have a train link with China at all. So, it was the roads. It's already winter. There wasn't a lot of traffic going back and forth probably anyway on those roads. But yeah, they've shut those down. It's more question of they're trying to find out if any of the Chinese workers there were home and came back sometime in the last 2 or 3 weeks, because they're worried about them. You rightly pointed out there was at least a rumor that a passenger had died on a plane coming back, and of course the Saman Airlines denied that happened. But there's always questions in these kind of situations about how much truth is in these statements or not. There's no reason to doubt this, but at the same time, the governments in the region don't want to see anyone panic. Certainly the Tajik government doesn't want any panic in their country. So, and the citizens know this too. They're used to their government sugarcoating bad news in the best of times and just not saying anything in the worst of times. So there's always going to be some suspicion that maybe something really is going on, and then the people just aren't hearing about it.
Right. Earlier, Dr. Parikh also spoke about this a little bit in terms of the Central Asian citizens who are in China, and especially the ones who are in Wuhan. What authorities are talking about them? Let's start with Kyrgyzstan, Ainura. What the authorities have done or what they are planning to do about them?
I don't think there is something special about these students. For now, as I told, we have only 12 students who came back from China, but others, we just had an interview with one guy who is in Wuhan. But I want to say that, outline that, most of them refused to speak to us, to talk to us.
Any specific reason?
Students in Wuhan. Wuhan, I don't know this. They are just kind of, I don't know, afraid or whatever. I don't know why, but they just refuse to talk to us about their situation.
And you said earlier...
But from government side, for now, it's I don't think something's bad. No, nothing.
Dana, Kazakhstan, the Kazakh authorities were, earlier I think you also mentioned that, I read this in a couple of other news sources, that they are in contact with Chinese authorities about those students. What they are talking about?
They're talking about trying to bring the students from Wuhan back, Kazakhstani students. And also Deputy Minister of Foreign Affairs in the interview to Azatek said that they are calling them, the students in Wuhan, and trying to understand what is the condition of them. And also some of the students, as he said, refused to come to Kazakhstan.
And reason being?
I don't know, actually.
No, maybe we can guess only that, it's hard to obtain visa, to go back. Maybe they're afraid that they couldn't go back to continue their, to study. I don't know. We can guess only.
An official saying is one of the reasons why the borders are not still closed.
That's interesting. About the borders, Bruce, I tried to bring in someone and kind of activist, NGO person who had some exposure to work with the health ministries in Central Asia, but in the final minute, she decided not to do it. My question is, we see these health specialists at the airport when pointing like the pistol-looking gun towards the forehead of people, obviously checking fever or something like that. But what I'm trying to understand is how Central Asian governments are equipped to deal with this.
Well, I mean, obviously, publicly they're saying that they have it under control. It tells you something that the Chinese government also said this 3 weeks ago, that it wasn't much of a problem. And then you look at the activity in China right now and how many cities are on lockdown. And you have to, it's reason for concern. There's no doubt about it. So for now, I mean, the governments in Central Asia all say they have it. The situation's good. They don't want people spreading rumors about anything. They're checking people. But as we heard the doctor say, part of the problem is that this thing incubates for like 2 weeks. Someone can get off a plane and they can point one of these temperature guns at their head, and they're going to register normal and they're going to feel normal. And the symptoms might not show up for a week or even longer after they're back home. And then, that's where the problem comes in. So, I thought that too. At first, everyone wants to get their nationals out and people are working to get their people back home. But, even as the doctor said again, it seemed to me that the better deal was to stay where you are. Although I understand that people aren't sick, don't want to get sick by staying in China, but by bringing people out, you just increase the risk that you're bringing the virus out with them. So for now, there are no cases as far as we know in Central Asia. They're checking at the airports. Yeah. Korgos is closed.
At Manas Airport, we have the equipment. Mm-hmm. We saw, our correspondent saw, we have a video, this, equipment to measure the temperature. Mm-hmm. Yeah, we have it, definitely.
We also do.
Yeah, so they're doing what they can, but again, it's just hard to say that people might be arriving that feel fine, but next week they might be sick. They might have carried this with them, and of course you can spread it even without the signs showing up. So if you're sick with it, you can give it to other people, even though you don't yet show any signs of being sick with this virus.
Yeah. Dana, a number of people that you mentioned at the hospital, but authorities are still calling them as suspected cases, right?
Because they are still trying to check their analysis.
So is there anything that I missed to raise?
Yeah, I want just to say that, for example, in Kyrgyzstan, there is another kind of spread of another kind of virus of false news, false information, which is important because, just for example, a message has been circulating urging people to not consume, bananas or oranges from China, etc.
Interesting. Yeah.
So this is and under the Kyrgyzstan's criminal code, the spreading of false information is punishable. And today, Interior Ministry repeated again that this is punishable.
Yeah, this rumors. Of course, we don't like to contribute to this rumor by creating unnecessary discussion about this. But anything that's happening in terms of rumor in Kazakhstan or rest of the Central Asia, what they are talking about?
A lot of them, and especially before that, we had some anti-Chinese moods in the society, but now it kind of increases after this virus news, and especially it is seen in the news about the tennis championship, which planned to be held in China, but International Tennis Federation decided to make it in Kazakhstan. But in Kazakhstan, this news brings a lot of attention and also reaction from the side of society, and that's why Kazakhstani government decided not to do that. So we will not have a tennis championship.
I think lately in Central Asia, especially in Kazakhstan, any news about China attracts lots of attention. So, Bruce, as a journalist, where our eyes should be going forward to determine what's going on, how authorities are dealing with this?
Well, one thing is you got to watch that. We know that it got outside China and it's in other countries, so we got to watch how if it really does spread. I'm sorry the doctor wasn't here, but right now this is a coronavirus. It's the same as SARS from 15 or 20 years ago, and it's the same as MERS from just like a decade ago. And in the case of MERS, for instance, that seemed to be something that was specific to the Middle East. It was, the mortality rate was much higher than SARS, for instance. I mean, it's like 30% of the people that got it died from it. But once it was centered in the Middle East, and when it got out of the Middle East, it just kind of filtered away, dispersed. It wasn't so deadly outside the region that it originated in. And this might be the case with this virus in China right now, this new virus, is that it's deadly because it needs the same kind of climate, the same kind of air quality, something like that. But like I said, we know that now it's in the U.S., and some people have it in Japan, and some people have it in Australia, and we got to see if they get better right away, and if it spreads from them, or it just doesn't, it can't, there's no way that in the climate that they're in that they can spread this like it does in the Wuhan area and parts of China. So that's I would say the first thing to watch for is to make sure that the cases that are outside China don't get any worse, because then that's kind of a relief. You can think, well, I live far from there and it probably won't be a big deal. And we were talking yesterday, and I think it's worth mentioning, there are a lot of Chinese workers in Central Asia. Right. And I know that people are suspicious now because, the disease broke out in China. But, it's worth reminding people that some of these Chinese workers haven't been home to China in months, and that they don't carry the disease just because they're Chinese. You're looking for anyone that came out of China first and foremost. So, being Chinese does not mean that you're more likely to have the disease. Having been in China, where the infection is broken out, means you are more likely to have the disease, and that can be anybody.
Yeah, definitely. Just final points here. Ainura and Dana, so as a journalist, when it comes to this coronavirus or its possible impact in Central Asia, so when you sit down in your editorial meetings in the morning, so what's the discussion looks like? Where your eyes are? What's that you guys are trying to report about, and what's the angle you are taking?
To give more information about disease and, preventive measures, of course, but of course told not by, for example, journalists, by me, or of course we interview a lot of people, health authorities, doctors, etc.
Is there any specific area that your eyes are to understand the possible impact and the things that authorities are doing about it?
No, we just report what they say to prevent, as you told, to prevent the false information. Right. This is why we have to give more information from health authorities, from government, etc., from doctors, of course, especially.
Dana, so where your eyes are when reporting about this situation in Kazakhstan, and where your eyes will be going forward to determine how authorities are dealing with it, how they are coping with this?
Regarding social media, for example, today we get one letter from kind of a document of one person having suspicious of having coronavirus before this official announcement. So as we see that the kind of official documents are coming to us as messages from our viewers and followers, and they are quite on the same page. And we will also look precisely on the words and actions that Kazakhstani government does, because it seems that they are trying to do their best, but there are kind of controversies in their actions, especially it is seen in the reaction of people. The reaction of people also, like some people want those students and those people from, even Kazakhstani citizens coming back from China, some don't. And we are also trying to understand the moods of the people.
Yeah, about people, may I just add that we had, for example, yesterday Vox Pop, we decided to ask some residents of Bishkek whether they know about this coronavirus, aware or what they know about the preventive measures. And most of them, of course, aware and about, which is good, aware about the preventive measures to avoid crowds, for example, to avoid handshakings and to wash hands and some these simple but important measures which mentioned doctor.
Obviously. Bruce, just the last point from you. How authorities are performing in terms of their messaging about this through their channels, or what they are saying or what they are not saying?
Well, it really does change from country to country. I would, from what I've been following, I would have to say Kazakhstan is putting out more information than the other two. Kyrgyzstan is a little bit behind Kazakhstan, but Kazakhstan has a dozen officials every day saying this is the situation, this is how many people we got, this is what's happening, and this is what we're doing with transportation and communications with China and everything. Kyrgyzstan puts some of that information out, and then of course Tajikistan is easily rock bottom, where they don't say enough at all. Just very few things about, they don't have any cases, they deny any rumors that anyone has contracted this virus, and just, simple things about, canceling flights, and when Tajikistan did stay, they were canceling, again, like I said, closing roads and canceling flights. At least as of last week, they were saying only that was typical during the Lunar New Year. It's only, in the last couple of days where they're like, well, it's, possible interest of further safety, we're still not going to do the flights that we already told you we were canceling anyway, and we're still not going to open the roads that we already told you were closed.
And it's unusual that Turkmenistan say something about in a situation like this, but they did, in fact, what they were talking about.
That's the worst case scenario, without a doubt. I was surprised they even mentioned it, but as always with Turkmenistan, it's the problem outside Turkmenistan. They didn't give any indication that there was any problem with that there. And that's actually, they're in the worst situation of any of them. I just helped out with the Economist and the World Health Organization with a report on Turkmenistan's medical system last year, and they're not in any shape to identify this or isolate people if it gets there. So, they're pretty much just hoping it doesn't happen, because if it does get there, they're going to be the worst off of all the Central Asian countries and trying to cope with it.
With this, unfortunately, we have to end the discussion here. Thank you very much, Dr. Purvi Parikh, the New York University School of Medicine professor and expert in infectious disease. Big thanks to Dana Sensiba, senior journalist with RFRL Kazakh service, Aynura Asankujayeva, senior journalist with our Kyrgyzstan service, Bruce Pannier, editor of Radio Free Europe Liberty Central Asia blog, Kishlak Awazi. Thank you, colleagues, for your time today.
Thank you.
Thank you.
Thank you too.
Thank you. And this is from me, Mohammed Tahir, Radio Free Europe Liberty's media manager for South and Central Asia. Please join us next week. Until then, bye-bye.